It's 3 a.m. and you're awake again. Maybe it's your bladder. Maybe it's a cramp in your calf so violent it takes your breath away. Maybe it's just a strange, hollow feeling in your chest that you can't quite name. And you lie there in the dark and you tell yourself the same thing you always tell yourself. This is just what getting older feels like. I need you to hear something before we go any further, because it matters more than anything else I'll say tonight. I'm Dr. David Thompson, and I want to be completely clear. I'm not your physician, and nothing in the next 20 minutes replaces a real evaluation from the doctor who knows your history, your labs, and your body. If you are having any of the symptoms I'm about to describe right now, tonight, as you're watching this, please don't wait for the video to end. Call emergency services. Everything else I tell you is meant for the version of you that's safe, curious, and trying to get ahead of a problem before it becomes a crisis. Because here's the deception nobody warns you about. We spend our whole lives being told that nighttime is when the body rests. The sympathetic nervous system stands down. Blood pressure dips. Heart rate slows. It's supposed to be the quietest, safest 8 hours of your day. But for a body that's quietly developing heart disease, or hardening arteries, or a failing airway, nighttime isn't rest. It's exposure. It's the one stretch of the day when gravity stops helping you compensate, when your heart can't lean on adrenaline to push through a blockage, when your brain isn't distracted by conversation or television or grandchildren. The mask comes off, and what's underneath gets loud. 4 of those nighttime signals get dismissed as just aging, more than almost anything else I see in my practice. Tonight, I'm going to walk you through exactly what your body might actually be telling you, and exactly what to say to your doctor to get it checked properly, calmly, and in time. Let's start with the one almost every person over 60 has been told is completely unremarkable. You wake up, you need to urinate, you go back to bed. An hour or 2 later, it happens again. By the 3rd or 4th time, you've stopped even being annoyed by it. You've just accepted it as the price of admission for getting older. Maybe someone told you it's your prostate. Maybe someone told you it's just a weak bladder from having kids decades ago. Both of those things exist, and both of those things can absolutely be part of the picture. But there's a second explanation that gets missed constantly, and it has nothing to do with your bladder at all. It has to do with your heart. Here's the mechanism, and I want you to really picture this because once you see it, you'll never forget it. During the day, when you're upright, gravity is working against you. Fluid that your heart isn't pumping efficiently enough tends to pool in the lowest points of your body, your ankles, your lower legs. If your heart is starting to struggle, even mildly, even in a way that hasn't been diagnosed yet, that fluid just sits there in your legs all day, and you might not think much of it beyond, "My shoes feel a little tight by evening." Then you lie down to sleep, and gravity stops helping. That fluid that spent all day pooling in your legs now has a clear, flat path back into your central circulation. It floods back into your bloodstream. Your kidneys suddenly see a surge in blood volume passing through them, and they respond exactly the way they're designed to. They filter it out as urine. That's why you're up. Not because your bladder failed, because your heart may already be under a degree of strain, and the only time you actually notice the evidence is when you're horizontal. This is a hallmark sign of early congestive heart failure, sometimes showing up years before someone ever gets the official diagnosis. So here's how you start telling the two apart. Ask yourself, do your ankles or lower legs look visibly swollen by the end of the day, even a little? Do you feel more winded than you used to climbing a single flight of stairs? Has your weight crept up a couple pounds seemingly overnight with no change in your eating? Those are fluid retention clues, and they point toward the heart, not the bladder. A weak bladder alone doesn't usually come with swollen ankles and shortness of breath as travel companions. I think about a woman I'll call Margaret, 71 years old, who mentioned to her doctor almost in passing that she'd been getting up 3 or 4 times a night for about 8 months. She'd already resigned herself to it. Her doctor thankfully didn't dismiss it. A simple blood test called a BNP, a marker that rises when the heart is under strain, came back elevated. An echocardiogram confirmed early heart failure with preserved ejection fraction. Caught at that point, it's manageable. Caught 2 years later after the heart has remodeled further, it's a much harder fight. Let's move to the second one, because this is the symptom that quietly kills more people than almost any other on this list, precisely because it's so easy to explain away. It's the middle of the night, and you wake up with what feels like heartburn, maybe a wave of nausea. Maybe you're sweating, even though the room isn't warm. You reach for the antacid, you tell yourself you shouldn't have eaten that late, and eventually it passes, and you go back to sleep. Here's what almost nobody knows. In adults over 60, especially those with diabetes, a heart attack frequently does not announce itself with the crushing chest pain we see in movies. It shows up disguised as indigestion. The reason is nerve degradation. Diabetes, and simply the process of aging itself, can dull the nerve fibers that carry pain signals from the heart. So instead of a dramatic, unmistakable chest-clutching event, the brain receives a muffled, ambiguous signal, and it often interprets that signal as coming from the stomach, because the nerve pathways from the heart and the esophagus genuinely overlap. This is called a silent myocardial infarction, and the word silent doesn't mean the damage is silent. It means the pain is silent. The heart muscle can still be losing oxygen and starting to die, quietly, while you're lying in bed convinced it's dinner disagreeing with you. Here's a rule of thumb that can genuinely save your life. Ordinary acid reflux tends to have a pattern. It often responds within minutes to an antacid. It's usually worse lying flat and better sitting up. And it doesn't typically come with cold sweat, unexplained nausea, or discomfort that radiates into your jaw, your neck, or down your left arm. A cardiac event, on the other hand, often brings a cluster of symptoms together, not just the burning sensation, but a sense of pressure or heaviness, cold, clammy skin, nausea that feels different from typical stomach upset, and sometimes an ache in the jaw or shoulder that has no obvious reason to be there. If you notice that cluster, that is not the moment to reach for the antacid and wait it out. That is the moment to call for help. I think of a man named Walter, 68, a retired mechanic, who described 3 separate nights over 2 weeks where he woke up with what he called bad heartburn and a cold sweat. On the 4th episode, his wife noticed his color looked off and insisted on calling 911. He was in the middle of an active heart attack, caught early enough to prevent major permanent damage. 3 prior nights, his body had been trying to tell him. He'd simply been handed the wrong translation. Now let's talk about the legs, because this one is often written off as the most harmless symptom on this entire list. You're asleep, and suddenly a cramp seizes your calf so hard it feels like the muscle is trying to tear itself apart. The instinct is always the same. Must be dehydration, must be low potassium, better eat a banana tomorrow. Sometimes that's exactly what it is. But when these cramps are severe, frequent, and specifically happen at rest, especially at night, they can be a sign of peripheral artery disease, and in more advanced cases, critical limb ischemia. Here's the anatomy. Arteries carrying blood down into your legs can develop plaque over decades, the same way arteries feeding the heart can. During the day, when you're upright and walking, your leg muscles are working, but gravity is also helping blood get down into your legs, and movement itself helps circulation along even through narrowed vessels. At night, when you lie flat and still, that gravitational assist disappears, and your resting muscles suddenly aren't getting enough oxygenated blood to keep them content. Starved of oxygen, they seize, violently. There's a simple, almost diagnostic test for this that's been used by physicians for decades. If you hang your affected leg over the side of the bed, letting it dangle toward the floor, and the pain noticeably eases within a minute or 2, that's not a coincidence. You've just used gravity to force a little extra blood down into a limb that wasn't getting enough on its own. That specific pattern of relief is a strong signal worth mentioning to your doctor by name, because it points toward arterial insufficiency rather than a simple mineral deficiency. I recall a patient I'll call Frank, 74, who'd been managing cramps with potassium supplements for over a year. What tipped things off wasn't just the cramping. It was that his feet had started looking pale and cool to the touch, and the hair on his lower legs had thinned out, another subtle sign of reduced blood flow to the tissue. An ankle brachial index test, a simple, painless comparison of blood pressure in the ankle versus the arm, confirmed significant arterial narrowing. He wasn't low on potassium. His legs were quietly being starved of blood. Now, the 4th symptom, and this one tends to frighten people the most because it feels the most dramatic in the moment. You wake up gasping, or with your heart pounding so hard you can feel it in your throat, or with a sore, dry throat that makes no sense given the time of night. Maybe your partner mentions you were snoring loudly, or that there were long pauses where you seemed to just stop breathing. The easy explanation is a bad dream, or dry air, or stress. But this pattern is a classic signature of obstructive sleep apnea, and it's directly connected to something far more dangerous: nocturnal hypertension and elevated stroke risk. Here's what's physically happening. As the muscles of the throat relax during sleep, in some people the airway partially or fully collapses, cutting off airflow. Your brain, sensing falling oxygen levels, goes into a genuine panic response. It floods your system with adrenaline and cortisol to force you awake enough to gasp for air and reopen that airway. That adrenaline surge doesn't just wake you up gently. It can spike your blood pressure into dangerous stroke risk territory, sometimes dozens of times a night, every single night, for years, often without the person ever being formally diagnosed. The pounding heart and sore throat you feel upon waking aren't random. They're the aftermath of your brain fighting to keep you breathing. This is worth taking seriously, not just because of the immediate discomfort, but because repeated nightly blood pressure spikes are a well-established contributor to long-term cardiovascular and stroke risk. If this sounds familiar, an overnight pulse oximetry test or a formal sleep study is the clearest way to get an actual answer instead of a guess. So here is what I want you to actually do with everything I've just told you. Write these down, or better yet, screenshot this part of the video and bring it to your next appointment. If you're waking to urinate multiple times a night alongside ankle swelling or new shortness of breath, ask your doctor specifically about a BNP or NT-proBNP blood test and an echocardiogram. If you've had nighttime indigestion with cold sweats or unexplained nausea, especially more than once, ask for an EKG and cardiac enzyme testing. And don't downplay the story when you tell it. If you're having severe resting leg cramps, especially ones relieved by hanging your leg off the bed, ask specifically for an ankle brachial index test. And if you wake gasping, pounding, or with a sore throat and possible snoring or breathing pauses, ask about an overnight pulse oximetry test or a referral for a sleep study. None of these tests are invasive. None of them are expensive as a starting point. And every single one of them can catch something early enough to actually change the outcome. If this video helped you connect a dot you hadn't connected before, type vitality in the comments so I know this reached you in time. And if there's someone in your life, a parent, a spouse, a neighbor, who's been quietly shrugging off one of these 4 symptoms, send this to them tonight, not tomorrow. That single conversation might be the thing that protects their independence for years to come. And again, if any of this describes what you're feeling right now, this isn't a video to finish first. Please, call for help. I'm Dr. David Thompson. I'll see you in the next video.